Welcome to the first CARE panel, Conversations Around Research Ethics, that is hosted by the Center for Ethics and Human Values of the semester. My name is Dana Howard. I'm an assistant professor in the Center for Bioethics and in the philosophy department. And I am really delighted to talk to you all today about the ethics of One Health research, which, given the sort of recent outbreaks of COVID-19 and Zika and Ebola, we've just really seen the way in which human health is so closely connected to environmental changes and our interaction with the other animals around us. And the One Health approach is this really exciting, promising way of thinking about conducting research that really takes this seriously. However, with the sort of complexity, the global collaboration, and then to the disciplinarity of this kind of approach, there are really interesting and distinctive ethical and regulatory challenges that I'm hoping that this panel will start us off thinking about. We are really lucky today to have three panelists. I'm just going to introduce them, and then I'm just going to go over what we're going to be doing today. So we have Dr. Joseph Mwanzia Nguta, who is a senior lecturer in pharmacology and toxicology at the University of Nairobi. Dr. Nguta is a veterinary surgeon by training, and is a senior lecturer at the Department of Public Health, Pharmacology and Toxicology at University of Nairobi, with 14 years of experience in undergraduate and postgraduate teaching and supervision. Dr. Nguta and Dr. Donald Omathuna, are currently collaborating on this really exciting project that through a collaboration between University of Nairobi and OSU. Dr. Omathuna is currently the PI of this collaboration, and they're basically building this program to strengthen the international research ethics training capacity in Kenya, which also at the same time is attempting to conduct research related to the ethical concerns that come out of One Health research and emergency health research. And Dr. Omathuna has research interests in both healthcare ethics and evidence-based practice, with focus and expertise on the ethics of disaster research, pandemics, and humanitarian crises. And finally, we have Dr. Rebecca Garibed, who is professor in the Department of Veterinary Preventative Medicine. Dr. Garibed is an epidemiologist by training and in research, and uses ecological and computer modeling to improve understanding of the mechanisms driving the transmission and persistence of diseases in populations of animals and humans, and has worked collaboratively in One Health projects with partners in Cameroon, in Chad, in Ethiopia, in Nicaragua. And recently she's the co-author of a paper entitled A CTSA One Health Alliance Guidance on Institutional Review of Veterinary Clinical Studies, which I think really does speak to some of these interesting challenges. So I'm so delighted to have you three here today. What we're going to be doing is we're going to start with really short introductions, and then I'm going to jump into questions because we only have an hour. And then for all the participants that are joining us virtually, throughout the talk, feel free to write any questions down in the Q&A at the bottom of your screen, and we'll definitely get to as many questions as we can near the end of the panel. So to no further ado, why don't we start with Dr. Nguta? You can introduce yourself and your experience with One Health.
Thank you, Dana, for those words and the introduction. As I did say, I'm Joseph, and I'm based at the Department of Public Health in the Faculty of Veterinary Medicine at the University of Nairobi, where we have continued to conduct research around animals, humans, and our shared environment. So basically, One Health is a collaborative effort of multiple disciplines working closely together, locally, nationally, and in a global scale to attain optimal health for people, animals, and their shared environment. Now, this paradigm did emerge from the recognition that the well-being of humans, animals, and ecosystems are not only interrelated, but they are also interdependent. Now, therefore, there is a need for more systematic and cross-sectoral approaches towards identification and response to global public health emergencies and other health threats which arise at the human, animal, and ecosystem interface. Now, One Health ends is a worldwide strategy towards expansion of the interdisciplinary collaboration and communications in all aspects of healthcare for humans, animals, and the environment. Now, the synergism that is achieved will advance the healthcare for the 21st century and beyond by accelerating biomedical research discoveries, enhancing public health efficacy, expeditiously expanding the scientific knowledge base, and improving medical education and the clinical care. Now, when One Health approach is properly implemented, it will help to protect and save the untold millions of human and animal lives in the present and the future generations. But then it is also important for us to understand the major issues in One Health. And these are mainly 5: the zoonotic diseases, environmental contamination, vector-borne diseases, antimicrobial resistance, food safety, and food security. Now, One Health approach engages, as I did say, humans, animals, and environmental factors. Now, this interdependence raises distinct ethical challenges, more so at times of emergencies. For example, at times of disease outbreaks, epidemics, and disasters. Now, One Health draws on scientific methodologies and evidence, but it also has ethical dimensions. It assumes that health is a good thing, and that understanding interactions between humans, animals, and the environment will help us to optimize the health of all, including maintaining and sustaining a flourishing ecology. Now, in this webinar, we are going to wonder that One Health is necessarily a normative project. For example, describing infectious disease risk, such as antimicrobial resistance, or even the pandemic potential of the highly pathogenic avian influenza viruses, HPAI, as One Health a problem raises a normative question, since the term implies that these problems should concern us all, and that resolving them will provide a balanced One Health benefit, and it will require some form of collective action. Now, such assertions appeal to community values, our shared beliefs about how the world should be for us and also for the future generations. As such, ideas such as collaboration, what we are currently doing, sustainability, and security are quite prominent in One Health discourse. But then the question is raised, which community values are important to One Health and in which context they should apply have yet to be clearly articulated. They need to be articulated indeed. One Health is gaining momentum as a global, scientific, and cross-sectoral approach to zoonotic disease, food security, and environmental degradation. Now, the normative dimensions and implications of One Health are in urgent need of discussion and debate. Over to you, Dana.
Thank you so much. That was a really nice overview. Dr. Omathuna, do you want to go next? And then afterwards, Dr. Garabed? Just introduce yourselves and just your sort of, yeah.
Yeah, sure. Thanks, Dana. Yeah, so my background is in healthcare ethics, and probably about 15 years or so ago, I became involved in some projects looking at healthcare ethics during disasters and humanitarian crises, and this sort of opened up my eyes and my investigations into some of the ethical issues that are going on around the world, and the unique dimensions that a kind of a global health perspective brings to all of this. And when I came to Ohio State about 5 years or so ago, I was introduced to the Global One Health initiative here that's based in the College of Veterinary Medicine, but kind of spans across the whole university. And that was my introduction to One Health as a concept. And I could quickly see that as we seek to address global health issues, and particularly the health issues that affect the parts of the world where poverty is an issue, where development is still occurring in a major way, that there are major dilemmas about the origins of various diseases and how people balance their lives where they're very closely in contact with animals and the environment compared to us in Western settings. And this creates a number of, I think, kind of distinct ethical issues where I think a lot of times a Western approach is very much concerned about the health of humans, means we address the ethical issues around humans, and human health is our primary focus. But in many other parts of the world, the health of animals is intimately tied into the health of humans in ways that we may not recognize. And so, for example, when sometimes a disease outbreak occurs, there can be an assumption that whatever animals may be involved, or the birds, that they need to be culled and eliminated. But this has huge implications for the animals themselves, for the humans who are in very close contact. If you go beyond the health issues, there's the economic issues, the livelihood issues, and the cultural issues about a whole way of life that's tied in. That the answer is not simply to kind of take human health as the only priority. And likewise, the environmental issues, as we've seen with COVID-19 and Ebola, that environmental changes are often the things that are caused by humans, but trigger changes in the animals or the birds, and therefore have ethical implications there. And those need to be taken into account. And so it creates this challenging setting where how do we balance the ethical priorities towards animals, the environment, and humans? And bioethics has really, I think, had very much a focus on humans, and how to balance these different huge factors is part of what I think needs a lot more investigation, and something that our collaboration with Joseph has been seeking to do. But I think we're in many ways just at the beginning, and that's part of what we're aiming to do together.
Thank you. And Dr. Garabed?
Sure. So Rebecca Garabed, I'm a faculty member in College of Veterinary Medicine, and I'm going to take this on a really practical position because I actually am doing a lot of the research. So when it comes to One Health research, it's a lot like other kinds of field research and international research, because a lot of times it's field research and it's international research. So it takes on all of the challenges that usually come with those those types of research. And the only thing that making it One Health seems to do that's different is that you're dealing with humans and you're dealing with animals. And when it goes to actually getting it done, the ethical reviews are very siloed. So there's the human ethical review for whatever you're doing with the humans. There's the animal ethical review for whatever you're doing with the animals. And they sort of have the way that they think about things. And it's always about, you know, cost and benefit to whoever you're doing the work on.
Mhm.
So when you go to phrase your IRB, it's all about, well, what are you actually doing with these people? What are they doing? And then you go to do the work on animals, and it's sort of like what pain and suffering and how many animals, and how does that contrast what the benefit is to those animals and then to humans in the larger scheme. So, I mean, from the researcher standpoint, you have to go through those separate processes separately. And I'm always wanting to say, but this is what we're doing to the animals at the same time on the human IRB. And I'm wanting to say, and this is what we're asking the people on the animal IACUC. So it's a little strange doing it in that siloed way. And the fact that you have to do the two. In other countries I've worked in, they don't always have that separated out that way. I haven't done this yet, but we're doing it through CHAD, and it's one board that reviews everything. So that's kind of a nice way of looking at it, of, you know, what's the whole project and how do the ethics play out with all of that. But it's the paper that we wrote was sort of related to this idea of, like, you know, what do you do when it's not like a lab rat in a cage, which is what IACUC is generally used to doing. But you have people who own animals, so they are speaking on behalf of their animals and getting to decide. So it inherits a lot of those like informed consent type things that are not traditionally part of an animal use protocol. So One Health research gets into kind of looking at the ethics more broadly, just for the research. That's leaving aside the, like, what you're actually testing and how it's going to be implemented, which is another ball of wax entirely.
That's really helpful. So, I mean, I'm hearing from Joseph, Donal, and Rebecca a number of different strands about some ethical challenges that really come up in some ways in this sort of intersection of all of these different kinds of research programs that One Health encapsulates. So one of the issues that Joseph brought up was just sort of the sort of who's ethical, like really thinking about these ethical questions and cultural practices, and how should we think about these normative questions in a culturally sensitive way. Donal brought up the question about prioritization and culling, and how that has meaning in lots of different stakeholders, besides just the, you know, aggregate public health benefit that is immediate in an emergency. And then Rebecca, you brought up, I think, a really important component that often comes up is sort of the ways in which the regulatory infrastructure was designed for something else. And as our research gets more complicated and more valuable to really address the concerns and the problems that we face, there is this sort of disconnect between the regulatory infrastructure and the ethical obligations on the part of the researchers. And sometimes you're working at odds with each other. And so I'm hearing a lot of really important ethical challenges. I do want to give you an opportunity to just, if you could, what is the, you know, the biggest ethical challenge that you face? Like, what is the thing that we should really start with? You know, the highest priority ethical concern that you have when it comes to One Health research. And maybe I'll have Donal go first, and then Joseph and Rebecca, if you have anything to say after that, feel free.
Well, maybe I'll answer indirectly by giving you the results of a survey that we have done with Joseph, involving a lot of people in Kenya and other collaborators in Ethiopia. And we asked researchers, members of IRBs, and regulators about these questions. And we also included open-ended questions where they could write in what they saw as the top priority. And by far, in the open-ended questions, by far the top issue was a whole collection of regulatory issues, like Rebecca was talking about, that I have to go to several committees, that it takes ages, that the people in the animal health committees don't seem to appreciate or be concerned about the human issues, and vice versa. And a lot of times they raised even larger issues, because with an outbreak type of research, you can be crossing borders. Or as one of our collaborators was involved with just investigating an animal disease outbreak, that they needed to cross into 3 countries if they were to truly understand everything that was going on. So you might not only have to do a number of committees, you might have to do the same committees in a few different countries. So those types of issues were felt to be some of the major issues. And the second most frequently brought up issue in the open-ended questions was around how do you balance issues, ethical issues between humans, animals, and the environment. If you can, benefit the humans by something that causes, the death of many animals, or maybe the mechanism of killing the animals has environmental damaging effects. How do you balance all of that? And the third most frequently mentioned issue was community involvement and community participation. That the means of engaging with communities in doing the research, how do you work through the procedures of informing the communities about what you'd like to do, getting their permission, dealing with their leadership structures, but then also having to balance scientific issues against respecting the communities, where so one person mentioned about how they got permission from the community and from farmers to do various tests on the animals, and halfway through the project the farmer changed his mind and said, no more of my animals, and that created scientific problems because they hadn't collected enough samples there. So again, trying to balance those issues, I think around, science versus or in combination with the ethics. So those are, at least how people in Kenya and Ethiopia were prioritizing those issues. I'd leave it to Joseph or Rebecca to give you their perspectives.
Yeah, thank you, Donna, and I can chip in. Yeah, and indeed, building on our study on One Health ethics and regulatory procedures project, we have talked with One Health researchers, ethics reviewers, both at the IRB level and also at the regulatory level, and listening to their concerns about balancing the issues, even in the proposals that they are reviewing, ensuring that the interests of humans, the interests of animals, and the environmental interests are balanced has been a dilemma. Mm-hmm. Many of these respondents have agreed that One Health is complex, and for sure they have not been looking at the ethical dimensions and the salient questions, ethical questions that are raised when One Health research is being conducted. Indeed, if One Health research and interventions that take a One Health approach have to succeed, they have to address the fundamental ethical questions. What is valuable? What do we need to protect? And ultimately, what can we dispense?
Mm.
Now, this interdependence, other than raising these ethical questions and dilemmas, it's about balancing the competing values and the priorities within the three sectors: the human dimension, the human sector, the animal sector, and the environmental sector. And again, also between the different sectors. And I'm going to give you an example. For example, brucellosis and rabies have zoonotic disease of top priority, not only in our country here in Kenya, but also in the United States. So when you are looking at a disease like rabies, for example, or anthrax, for that matter, an outbreak in a given farm, smallholder farm, in a given county in Kenya, we have the disease itself in the animals. We have the people whose livelihood depends on these animals. We have the environment, because we also need to ensure that the anthrax spores and do not contaminate the environment. Again, we have the public health, because we want to protect the health of people.
Mhm.
How do we balance the interests of the environment? How do we ensure environmental health when we want to protect the public health? How do we take care of the many people whose livelihoods depend on these animals, which, for example, we would like to euthanize because they are suffering from anthrax, and we want to protect the health of the people? Now, these are key questions, because at times the communities may refuse, despite the fact that we want to protect the public health. Here is my animal. I depend on it to take my children to school. I depend on it to earn my livelihood through milk. If it is euthanized, what am I going to do? The socio-economic aspect comes into play. So much as the intervention may be good, which could be to euthanize all these animals to protect the public health, the communities may summarily reject that proposition by the government authorities.
Mhm.
Again, even when it comes to the ethics review committee, and they are reviewing such a research protocol, it again becomes a dilemma, because in many instances, we do not have the three sectors represented in the ethics review committees. So they are still not in a position to make ethical decisions on how best to go about such intervention to protect the public health at such a time when there is an outbreak of anthrax in animals. So these are the committee interests and the values, which then not only the ethics review committee members, but also the researchers need to balance as much as they want to protect the public health. So to me, the most significant ethical challenge in One Health research is how can we best balance the competing values and priorities within and between the different One Health sectors.
Thank you. I appreciate this idea that part of what research priority setting is doing is in some ways expressing questions about what we should be protecting and what ultimately is dispensable. And I think that often people don't think of the dispensability of entities, of animals, and potentially of populations or environments as a feature of the ethical considerations that come when it comes to the research that we decide to conduct. So I really appreciate that point. Dr. Garibed, do you have your one priority that you wish would really be handled related to the ethical challenges?
Yeah, so I mean, there are 2 points that kind of came up. So, and yeah, there were things I was going to mention too, but I'm going to phrase them slightly differently. So Dr. Nguta had mentioned what I kind of phrase as like the balance between control of a disease versus research of a disease. And that is sometimes challenging. Of you want to just go out and control the disease because that's in the ethical best interest of the situation, but not having the research to support what you should be doing. It creates kind of an interplay of you want to recommend the best thing, but you can't because you've never seen this situation before. And I feel like that is a big challenge when that occurs. And I guess as a secondary part, I think that Donald mentioned like the well-being of the people versus the well-being of the animals versus the well-being of the system. I don't know if I'm phrasing that right, but the people always take precedence. Like, so from coming from the veterinary side, the people always take precedence over everybody else, which, you know, speaking for the animals, sometimes I get a little frustrated with, because sometimes it is sort of this short-sighted giving preference to the humans. But then it gets into these questions of what's acceptable cost to the humans to help the whole system. So yeah, I don't know if that's not one thing, that's a whole bunch of things.
So this is like really helpful, and it just sort of jumps into the next question. And I mean, in some ways it's like this balancing between these different stakeholders seems like, and the potential conflicts, that One Health research approach really does make salient. Like you just can't, you have to actually like navigate these issues when you're actually trying to get the research approved and conducted. And so I don't exactly want to put you on the spot to like give us the solution, right? But you know, you have brought up this real important problem of this research is spanning humans, animal, environmental considerations, also public health considerations of human stakeholders that aren't necessarily the research subjects or the or providing authorization on behalf of animals, right? So we have this also sort of public concern stakeholder that isn't necessarily represented in the people providing consent. And these considerations are going to come into conflict with each other. And so how do you think we should handle, and what does a proper balance look like? You mentioned, Dr. Garibed, that it might be short-sighted to always, for whatever reason, unconditionally prioritize human welfare above all other priorities. So one question I just have is like, how should we go about navigating this conflict? And is there some sort of regulatory oversight that you think would be a better fit for facing this dilemma head on, rather than the sort of siloed way that it seems like most countries are handling One Health research? And maybe Dr. Garibed, you can start us off this time, and then we'll go to Dr. Mwanzia and Dr. Nguta.
Yeah, so give me the hard one. Okay, so I mean, I do think at some point people need to look at the ethics on a broader scale. So in the US, our regulatory ethical oversight has gotten very, very specific. And it's the individual protocol for the individual thing tends to be just for looking at humans or animals, and there's very little even looking at environmental impacts. So yeah, like I feel like there does need to be some sort of broader consideration that looks across things, across studies, across species being involved, and settings. I don't know what that looks like, but it would be nice to have people with expertise in all of those things who are looking at one protocol in a unified way.
Mhm.
So that would be one way. And it I don't know, it does seem, I haven't been through the process yet, but it does seem that that's what they do in Chad. They have like ministry representatives from all of the relevant ministries, including environment and fisheries in there. And they're all looking at the protocols. So
No, that's
I'll
really
start
helpful.
that off.
That's great. And then one thing that I want to like highlight in part of your response, which I think is really interesting, is like thinking about regulatory oversight for a particular protocol, and then thinking about the portfolio of research that is being done and the way in which this particular research program is like, what other research is being conducted, and what, thinking about broader environmental impacts or something like that, you might actually have to think on a much more like systems level rather than an individual approval of a specific protocol in order to take some of these considerations seriously. Anyway, Joseph or Donald, what are your thoughts about how to navigate this balance? And if you have any ideas about the regulatory oversight body that can actually address these complex concerns.
Can I chip in? Yeah, thank you. Thank you, Dana, for this question. And it's a question which we did ask one of the research scientists and ethics review committee members and ethics regulators. And it is a complex, it's a complex question on how to best balance the competing values and interests across and within the three sectors. But then the success of the intended outcome from one of the interventions is likely be determined by the extent to which they are going to reflect on the local circumstances and the needs of the communities. The extent to which the people which are affected by these zoonotic, for example, disease outbreaks, can be persuaded to accept the possibility of a personal cost in return for a collective benefit. Now, limitations of freedom comes into play here, which may necessarily require consultations to determine which specific measures are legitimate in the light of the perceived conflicts of different interests between individuals, institutions, and the broader community. But then remember, even if the proposed one of the interventions are ethical, they may likely to be rejected by the communities unless they are perceived to be fair, to be not disproportionately burdensome, and also to be in a position to be appropriately implemented. In a nutshell, we need to involve the affected communities when we are carrying out one health research and even one health interventions, such as disease outbreak investigations. That is the only way that the communities can buy into the idea of, for example, euthanizing the animals. And again, disposing these animals in a manner which is friendly to the environment and ultimately protect the public health.
So could I ask a question of Dr. Nguta?
Please go ahead.
So involving the communities and people and animals that are affected, well, not animals because they can't talk for themselves, but the communities that are affected, do you feel that that ethical obligation falls on the researcher or the government or the institution doing the control? Who should be pulling in the community and getting their consent, I guess, would be the best way to phrase it?
Yeah, thank you. And this is a good question. Who should be reaching out to the community? It is an obligation for us all, because the intention is to ensure that there is public health, while still ensuring that the health of the environment is taken care of. And the health of animals, or the interest of animals, are also taken care of. And who is that person who is going to go to the communities? And that's a question that we really did raise with especially the ethics review committee members. And we even did go ahead and ask, do we need to have a representative from the community seated in the ethics review committee? Because these are the people who best know the dynamics in the community, who knows the culture of these people, who knows what needs to be done and what does not need to be done. And it came out that it was quite important to have representation of community at the ethics review committee, where the research protocol is going to be approved for this intervention or for this research to be carried out at the community level. So it is not about the government, because we have an institution which is required to approve that intervention to be carried out. That is the ethics review committee. So what is the role of the ethics review committee in this space? That's the question that we asked. And yes, they accepted that we indeed need to have representatives from those communities. Otherwise, they did share with us scenarios where researchers have been chased from the site, where researchers do not collect data, where researchers will not be accepted by the different communities. And basically that may as well be the end of the intervention, because who are you intervening if the community from where the data is being collected from are not willing to accept you?
So let me just ask one further sort of preset question, and there's some really interesting and important questions that are coming up in the Q&A from the audience, and I want to get to those as well. And this is in some ways going back to a point that Dr. Garibed was making about sort of framing it in terms of controlling some sort of pandemic or some sort of disease versus researching it. And sometimes it's not necessarily only a conflict between the different stakeholders, but actually a conflict about studying something, studying the phenomena versus controlling it and trying to make sure that it is no longer spread, right? And so I think I'll start with Dr. Omathuna, because this is sort of within your ethical research more broadly. But how does the fact that so much of the One Health research is taking place in these emergent and emergent disease contexts or emergency situations, and sometimes in humanitarian crises, right? Like how should we think about the ethical considerations that come up given the sort of emergency context in which this research is taking place?
Well, I think this is part of, adding even more complexity to some of the things we've been talking about, because if there are animals dying in a region of the country, there is an urgency to go figure out what's happening, if either to identify a known disease or realize we've got something new that's spreading. And I think it adds further complexity in terms of the idea of the urgency is really a matter of, possibly life and death for humans and animals and components of the environment if, some types of spores or infectious agents get into the environment. And part of what I've been thinking about as we kind of go through some of these questions is that in a lot of ways, it's like communication and respect our underlying priorities in this area, that what's needed is a way to communicate with the people affected about the urgency of doing something. And they probably will say, yeah, I know my animals are dying. And letting them know as well as possible that, you know, here's what we would like to do. We need to, you know, take some samples from the animals or the environment, collect some information from you about what's been happening human health wise, or, you know, nutrition wise, or whatever is going on. But that involving them in that, informing them, discussing with them, and then also, you know, making a commitment to say, and we will be back with our results. We will share those with you. If we learn that something different needs to be done with the water or with the animals, that's part of this commitment. And when you bring that into an international scale to kind of get at something that Rebecca asked, you know, I think this is where One Health can't be simply a localized approach to these issues, or it can't be where investigators from one country land in another, you know, country and start, you know, to say, well, we want permission to do this research. That the collaboration that is central to One Health research is about collaboration between various researchers in different countries. So, for example, at Ohio State, with people in Kenya who also know the researchers in the university or the organizations and have connections with the communities where they're going to go. And so it's having what I think maybe a One Health ethics can bring to all of this is a commitment to open dialogue, to listening to the affected communities, to feeding information back, building the sort of respectful engagement that Joseph was mentioning, where the people understand what is what the researchers would like to do. They're willing to let the researchers in, and they can also see there'll be some benefit from this because we'll learn something new about how to avoid or prevent or treat this this situation. And that through that, they don't simply get to help the researchers with their projects, but maybe then as becoming part of the system, they can say, well, actually, we've got this other problem going on here, and we need some researchers to come back later on and do some research into why this is happening with our crops or whatever it might be, and start to build this integrated system that really is at the heart of what One Health is. And it's not an easy system. It's not a system of saying, well, this is number one priority and everything else has to fall under it. But it's more about this communication and dialogue and respect for all the people and the components, the animal world, the plant world, the environment in general, and making our way to improve the way things have been done compared to maybe how they might have been done a few decades ago.
So do Dr. Garabet or Dr. Nguta, do you have any other sort of ideas about the emergency nature? Otherwise, I have two questions from the audience that I think are fabulous questions that I would like to get to. So let me start with this one from Corey Cooper, who I think picked up on something that Dr. Nguta was saying early in the conversation. Does One Health approach to research require a unified worldview? So when we're asking, like, how do we balance, you know, these different priorities and these different ethical considerations, are we sort of negotiating the ethical standing of human, animals, and plants in the ecosystem in some sort of universal way? How should we think about the answers to these ethical dilemmas?
Yes, I'm going to respond to that question and say yes. And this goes back to the definition of One Health. I mean, what is this approach? An effort of multiple disciplines. It is just not about environmental health scientists. It's just not about veterinarians. It's just not about social scientists. It's just not about medical scientists. It's just not about ethics. And again, these multiple disciplines are working together locally, nationally, and globally to attain optimal health for people, animals, and their shared environment. Dana.
Thank you. Any other sort of thoughts on that one? Well, this is a really interesting question from Sion Habte about mental health and how whether mental health and not just sort of physical health is a component of considerations when it comes to One Health interventions. So how do you see the mental health of humans affected when applying the approach of One Health intervention in a particular community with all the prioritization dilemmas as mentioned? Do you think ethical, sound approaches that protect the mental health of humans are addressed in the One Health approach?
I think there's a lot of space for it. I think it's very much integrated. I think we do a poor job of including that as one of the considerations. So for example, what Dr. Nguta has been mentioning a lot of times of, you come in and you cull somebody's animals. So there's the direct financial impact and livelihood impact, but there's also often like a mental health impact there that doesn't usually get included in, the equations for figuring out how best to control something. So I think we could do a lot better than we do.
Yes, I totally agree. And that's why we need to work very closely with the people who are affected. Because the decision from the existing framework, from the regulatory framework, may not go on well with the communities. And as Dr. Rebecca is saying, what do you think of such a small scale farmer with one dairy animal? And the family is relying on that one animal. It's the only source of livelihood. And then you are coming to tell such a person that, we have an outbreak of brucellosis, of anthrax, of trypanosomia, and we need to kill your animal. Then the next question is such a person going to be compensated? So that's why it is quite important to balance those interests, because they can easily give rise to such medical condition as depression, because such a person can easily be depressed. And on the other hand, now when we are looking at One Health research, the issue of special populations is also taken care of, because we also address the conduct of this One Health research, also with the special populations. And I think mental health people or people with mental health problems can be categorized as a special group of people. That's my take, Dana, on that.
Thank you. And so there's one final question from the audience that I think is an interesting one. And in some ways it comes out off of one thing that Donna was mentioning about like sort of the sharing of information and research findings in a way that is accessible to the community and can be actually put to use, and then actually having an iterative process of further research in the priorities of the community once the researchers are already there and the resources are already on the ground. And this is the question from Nahida Hamza about data sharing and how that data sharing amongst stakeholders in One Health research can be another barrier. So what do you think about the ways in which data can be facilitated across these different populations when you're doing research? And how can we think about a way to facilitate data sharing with the communities that are being researched?
Well, I'll just give you one example from a paper that was published I read a few years ago, and it was a nutrition focused study. Just on human nutrition, and they had recruited and trained data collectors from within the communities that went out and collected all of the data. But as part of the project, they built in a time where after the results had been collected, where each of the data collectors and the researchers went back out to the various communities. And they basically had a party or a celebration of what had been learned, what had happened with the information that they were able to talk about, how it had gone to the Ministry of Health, that they were considering that. And the researchers commented on how they were even surprised themselves at the level of enjoyment and pride that the communities had in the fact that they contributed to something that got to the Ministry of Health, but also that members of their community now were trained data collectors and were going to go on and get involved in other projects. So I think it needs to go beyond our focus, I think, sometimes as academic researchers on getting our publications, maybe getting a policy brief if we think that far, but to seeing how do we respect and engage the communities from where the data is coming. It is their data. It's they who will make the research successful, and coming up with ways to do this in meaningful ways. And looking for those sorts of opportunities. And it will there's probably as many different ways of doing it as there are projects out there, but thinking creatively about that element of the project is what I think we really need.
Yeah, I mean, I'll just add on there that I have a challenge with this a lot of what is the most meaningful way to share the information. So, I mean, One Health research can be very expensive and it can be very slow. So by the time we actually get some sort of really meaningful result, it might be 5 years or more since we started the project. So I often wonder, what can I give people like now, like within a year of when we've been there, as opposed to 5 years later, is it going to make sense if we come back, or are those people even still in the same communities? It's, we studied something a while ago, so is it still relevant today? That I have a challenge with. And then the sharing for other researchers and across systems and things that might be useful, that is also a challenge, because research gets collected, like data gets collected for a specific purpose. And it doesn't always carry over to the next purpose very easily. There are data repositories, which are great, but getting the information that data is there to the right person, there are folks working on those kinds of things, but it's a challenge.
Unfortunately, that is where we're going to end today. But I really think that I really want to thank the panelists. It's clear how complex One Health research is. And I really appreciate the work and the thought that you're bringing to the research, both the ethical components and actually conducting epidemiology and veterinarian research. Thank you so much for sharing your insights and making us realize how complicated it is. We appreciate it.
Could I just finish with one other point that I've picked up from Joseph and his colleagues in Kenya, is that I think we in the West have a lot to learn from African and other traditional philosophies, because they are dealing with this type of issue on a day-by-day basis in ways that we maybe are not in our cities and away from agriculture a lot of the times. And so it's listening at this level as well. Okay, we got complicated questions. Let's listen to the people who are in the midst of these situations and see how they approach it in their philosophies and cultural traditions.
Thank you, Donal. Well said. Thank you everyone for joining us. And the next CARE panel will be the ethics of conducting research on pregnant persons. And that is going to be about a month away. So look for emails related to that talk soon. Goodbye for now.
Bye-bye. Thank you.